Alright everybody, this is Dan Fouts, and Dan came in today with some rib pain, so can you tell everybody a little bit about what you were telling me?
I think I cracked it doing 20-year-old stuff on the Wave Rider thing down. We were on vacation. So that stuff, when you crash, it's just yard sale. You have no control. So I think I landed on my elbow. Pretty sure I cracked my rib. It didn't hurt right away, so I kept doing it. But about an hour later, I sneezed and I realized, oh yeah, okay, that hurt really bad. So figured I cracked it, and then it's just been kind of hurting off and on ever since. It's been about a week ago.
Okay.
Since that happened.
So yeah, he said a little over a week. So usually if those injuries aren't resolving within a week, there's something kind of deeper in there going on. So we did a couple of tests with Dan. I figured out that it's probably not fractured, but like you said, possibly a crack, which would be a hairline fracture inside the rib. Those are really difficult to see on x-ray. In fact, we can't see them very often because there's so much vascularity inside the lungs when we shoot those x-rays. And so as long as he's not having reduced oxygen absorption, O2 levels are good, and he's not just in excruciating pain, we kind of tend to just let these things heal on their own. We talked about a couple of different things. He's really sore right on that mid-axillary line right through here, which is really consistent with a fractured rib or a cracked rib. But then he's also really sore right in the front. We talked about that's where the ribs attach to the cartilage that attaches to the sternum. And so one of the conditions we'll see often when somebody has a rib injury is something called costochondritis. And costochondritis is inflammation of that articulation where the rib attaches to the cartilage there. And this thing just takes forever to heal because every time you breathe, your ribs move, and that joint moves. If there is irritation in there, it doesn't settle down very quickly. I was explaining to Dan, if you have a sprained ankle, I can wrap it, ice it, elevate it, and tell you not to move it, and it tends to heal very quickly, but we can't do that with the ribs. We've gotten away with rib belts because we were having other problems, secondary complications like pneumonia, and so really we just let the patients kind of go through it. But it is highly responsive to ibuprofen. We talked about that. So with Dan coming in here a week after his injury, this is where a lot of chiropractors go wrong and do quacky things. They start adjusting, they start doing things and making problems worse. And today, what did we do, Dan, with your rib?
Nothing.
Perfect. We did nothing. We're going to let it rest. We're going to let the body do what it's supposed to do. And then he'll come back in about 4 weeks. You can definitely feel how there's a slight separation of that cartilage and that rib in there. And so when he comes back in about 4 weeks, as long as the inflammation settled down, then we'll go ahead and reset that rib for him, and it'll feel a lot better. And he'll go through the rest of life without a bunch of rib problems right where that articulates. So
it's like a dent right there.
Yeah, it certainly needs a little bit of love, but it's too early now to do it, or it would cause a lot more problems. So in any case, that's kind of our case study for today. Dan, thanks for being a good sport, and I appreciate you.
Anytime.
Thanks, man.